In the last class, we studied up to the natural and barrier methods and of contraceptive. And today we are going to study about the other methods of contraception. The other methods of contraception we are going to study today. They are intrauterine devices and oral contraceptives and injectables and sterilization method. All four we will study today. So contraceptive devices are the devices which are used in preventing the pregnancy, avoiding the pregnancy. And today, the next topic is IUDs, okay. Intrauterine devices. Intrauterine devices. Intrauterine devices. Intra means within. Intra, within. Uterine means within the uterus. Within the uterus. These devices are inserted into the uterus. Inserted into the uterus through through the vaginal tract and cervical tract. Okay. The devices inserted into uterus through vaginal and cervical tract. Vaginal cervical root or tract, whatever. Through vaginal and cervical tracts. And by only doctors. By only doctors. In the females. It is exclusively females. Okay, understood. I'll arrange, don't worry. Okay, now clear? So by only doctors, exclusively by doctors only, and they cannot be self-inserted. Okay, it may leads to the damage of the vaginal and cervical tract. So many complications may it leads to. So that's why only doctors has to do this, and exclusively females only. This method is exclusively used in females only. Okay, and these uterine devices, intrauterine devices, will kill the sperms. They can kill the sperms, or also they can stop the movement of the sperms motility. They will stop the mobility or motility of the sperms, and they can kill the sperms. Stops motility of sperms and kills. The process of killing is nothing but phagocytosis. The process of killing is nothing but phagocytosis. Phagocytosis. And now we are going to study types of intrauterine devices. Types of IUDs we are going to study. There are three types of IUDs. Three types of IUDs. Types of IUDs. Types So there are three types of IUDs. First one, non-medicated. Non-medicated IUDs. Intrauterine devices, shortcut IUDs. Types of IUDs. Types of IUDs. Next, copper releasing. Copper releasing. Non-medicated, copper releasing. Copper releasing. And third type is hormone releasing. Hormone releasing. Hormone releasing. Non-medicated, copper releasing, hormone releasing. Totally three types of IUDs. Totally three types of IUDs. Non-medicated means they are just they will stop the motility of the sperms. They are not having any special medications. Okay, they do not have any medications or equipped with any particular medicinal substances. So non-medicated, and they retard the mobility of the sperms. They will retard the mobility of the sperms. So once again, I'm telling, I think it is clearly visible and audible. Okay, for nobody, it is difficult. So they retard the mobility of the sperms. Retard mobility of the sperms. Retard the mobility of the sperms. Not medicated. Also, they also equipped with, okay, it also equipped with the effect called spermicidal effect. Spermicidal effect. That means the sperms may get killed also. The spermicidal effect. Okay, spermicidal effect. Spermicidal effect. Spermicidal effect. Sperm killing. Spermicidal. Sperm killing. Okay. Next, example of the non-medicated IUD, lipase loop. Example, lipase loop. Lipase loop. And coming to copper releasing. Copper releasing IUDs means these IUDs are equipped with copper. IUDs are equipped with copper. And these copper ions will suppress the motility and fertilizing capacity of the sperms. The copper will act against the sperm's activities. That's why the copper is equipped here. Okay, there is no any special reason. Copper will act against the sperms. It will be against the sperms. The copper will suppress the motility and fertilizing capacity. Copper ions suppress motility. Suppress the motility. It will suppress the motility and fertilizing capacity. Fertilizing capacity. Fertilizing capacity of the sperms. Fertilizing capacity. Fertilizing capacity of the sperms. The copper ions. The copper ions will suppress the motility and fertilizing capacity of the sperms. And examples of the copper releasing IUDs are CUT, CU7 and multilode 375. CUT, copper T, and copper 7 and ML375. ML stands for multi-load. ML stands for multi-load. Multi-load. These are the examples of copper releasing IUDs. CUT, CU7, ML375, multi-load 375. They are copper releasing IUDs. Now coming to hormone releasing IUDs, they make the uterus unsuitable for implantation. This hormone releasing IUDs makes the uterus unsuitable for the implantation process. Unsuitable for the implantation process. That makes the uterus unsuitable for the implantation process. And also, it will makes the cervix hostile to the sperm. That means the sperms may die when they enter cervix. Makes the cervix unfavorable condition. Makes the cervix hostile, unfavorable. Hostile means unfavorable to sperms. Okay, so two kinds of effects. It makes the cervix hostile and also it makes the uterus unsuitable for implantation. So both functions. Example, progesterone. Example, progesterone. Example, progesterone. And one more, LNG20. That means levonorgestrel. Levonorgestrel means LNG. LNG20. Hope it is visible, everyone. I think it is visible. Yes. Okay. So all IUDs completed. If you have any doubt, please raise your hand regarding IUDs. Regarding IUDs, please, anybody have a doubt, please ask me. Next.
Sir,
Yeah.
sir, this hormone releasing IUDs, if in futures, if the hormone is still there in uterus, if the female wants to get conceived, will it have any problems, sir? Will the hormone stay or it will be washed out during menstrual cycle?
See here, the question is not clear. Your question is not clear.
Sir, this hormone releasing IUDs will release hormones for these sperms to for non-motility for the sperms.
Hmm.
If it is still there in the uterus, will it be any causes for these future purposes?
Definitely. These IUDs will be for a specific time. Okay, at least for 1 month, 2 months, 3 months. It will have some effect up to particular time duration. Up to that, there will be no fertilization and implantation can happen.
After it is removed, until some period of time, it will be there.
Yes.
Okay. Sir.
Okay.
Okay. Sir.
Sir,
Yeah, please.
sir, you said copper releasing IUDs will release copper, no, sir. And one of the example is copper tea.
Hmm.
But I heard it in 10th class, ma'am said copper tea is also used to crush the ovum, sir, like before entering into the uterus. Is it true?
See, whatever the mechanism, these IUDs will show effect mainly on the entry of sperms and motility of the sperms. The copper is mainly suppress the motility and fertilizing capacity of the sperms only. The copper ions.
Okay, so it does not affect the ovum, sir.
We cannot say that. Why? Because there are certain IUDs called hormone releasing IUD will also make the cervix hostile to the sperms. Apart from that, it makes the uterus unsuitable for implantation.
No, sir, I'm asking only for related to copper T.
Copper means only acting on the sperms.
Okay, sir.
Okay. So shall we start next topic? Oral contraceptive devices. Oral contraceptives. So give thumbs up reaction if you have understood, everyone. IUD'S, if you have understood, please give thumbs up. If any doubts, please raise your hand. No issues. So the next topic, oral contraceptives. Oral contraceptive. Oral means mouth. Through mouth, oral route, digestive route. If the individual is going to take the contraceptive, the medications, they are nothing but oral contraceptives. Oral contraceptives. Oral contraceptives. Okay, oral administration of the combinations, drug combinations. So I will tell you what are those drug combinations. Oral administration of the drug combinations. Those drug combinations are two drug combinations. First one, progestogen. The first one, progestogen. The first combination is progestogen. Second drug combination is progestogen estrogen combination. Progestogen estrogen combinations. These two drug combinations, any one, either progestogen alone or progestogen in combination with estrogen. So these two combinations in the form of tablets, in the form of tablets, in the form of tablets. In the form of tablets. That is called oral contraceptives. They are nothing but oral contraceptives. Okay, oral contraceptives. These tablets are also called pills. These tablets are considered as pills. Pills. Oral pills or oral contraceptives. And these pills are taken can be taken on a daily basis. Can be taken on a daily basis. Daily basis. Suppose if the female wants to take a daily, she can take for 21 days. 21 days, starting from within the first 5 days of menstrual cycle. Starting from within the first 5 days of menstrual cycle, up to 21 days continuously. Okay, starting from any 5 days menstruation phase is there, no, in that phase any one day she can start and continuously 21 days she has to take. Again after 21 days during luteal phase she has to give a gap of almost 7 days. She has to give a gap, again come back to the same day, like if she want to take daily basis. Okay, so starts taking from any day of first 5 days, any one day in the first 5 days of menstrual cycle, menstrual cycle, and continues up to 21 days, and continues up to 21 days. Continues up to 21 days. Again, 7 days gap. Again, 7 days gap. So totally again 28 it will become no. Anyhow, the menstrual cycle is 28 days only. 28 to 29. Same thing. So she has to take 21 days. From when? Any within the first 5 days. Within the first 5 days of menstrual cycle, she has to start taking 21 days continuously. And again, 7 days gap she should give. Again after 7 days gap. Because luteal phase, during luteal phase, she has to give 7 days gap and again she can take. So this is how, okay, the pill, contraceptive pill, how it should be taken, right? And it has to be repeated in the same pattern, okay? It has to be repeated in the same pattern if she is intentional to have the pills, okay? She has to repeat it. And generally, these combinations like progestogen, first progestogen and second progestogen estrogen, these combinations will be inhibit the ovulation process. Inhibiting means slow down or stops, inhibits the ovulation process and implantation process, and it will cervical, it will act on the cervical mucus. The cervical mucus, it will increase. The thickness of cervical mucus will increase so that it will prevent the entry of sperms. So what are the effects I'm going to write now? What are the effects of these drugs? I'm going to write. First one. Okay, first heading, effect of the drugs. Effects. Number 1. The first effect is, what is the first effect I told? Inhibit ovulation, I told you. Inhibit ovulation. Inhibit ovulation. Inhibit ovulation. And second one, the second effect is, it will affect implantation. Inhibit implantation. Okay. Inhibit implantation. Next, number 3, it will prevent the generally it will prevent the entry of sperms by increasing the thickness of cervical mucus. Increasing the thickness of cervical mucus. Cervical mucus thickness increases to prevent the entry of sperms. To prevent the entry of sperms. To prevent the entry of sperm. These are the effects of oral contraceptives. Oral contraceptives. Okay, and these pills are very effective. Pills are very effective with very less side effects. Pills are very effective with less side effects. And I have to explain you about the most important pill in India, that is called Saheli. Saheli is the most important pill Saheli. 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 Saheli is the new oral contraceptive. Actually, there are many oral contraceptives. New oral contraceptives have come. Okay, it was there in our textbook. There are many ideal contraceptives now developed because pharmaceutical industry has developed a lot. Right. This is according to some old textbook printing version. Okay, there are a lot more. Okay, why not? Sorry, Saheli. It is considered. It was considered as an ideal contraceptive pill. Ideal contraceptive pill. Why? Because least side effects. Very least side effectal, and no any steroidal components. No any steroidal components, and it was oral only, right? And once in a week pill. Only weekly once she has to consume this pill. Okay, once in a week pill. Once in a week pill, and no steroidal no steroidal inclusions. Okay, no any steroidal components are present in this, and it was developed by Central Drug Research Institute. Central Drug Research Institute. Central Drug Research Institute. CDRI. CDRI. Central Drug Research Institute. Saheli is a once in a week pill, and there are no any steroidal inclusions, and prepared by Central Drug Research Institute. Central Drug Research Institute, that is located in the Lucknow, Uttar Pradesh, Lucknow. And coming to this once in a week pill, very few side effects and high values. Okay, very few side effects, high contraceptive value, few side effects and high contraceptive value, high contraceptive value, high contraceptive value. So this is all about the oral contraceptives. Oral contraceptives. Anybody have a doubt? Please raise your hand. If anyone have a doubt, you can raise your hand, please. Charanya.
Sir, if the pills are taken more than the limited period, will it have side effects?
Definitely. Definitely it will have side effects. Why? Because every drug and according to the body weight mass index, the person has to take the pills. The amount also will be varies. And more than the required or recommended dose, if the person takes any drug, definitely it will be stacked in the body. Got it?
Okay, sir.
Definitely any drug, not only this one, not only this particular drug, any drug. If we are going to take overdose, definitely it will affect. Okay. Surya.
Sir, are they like oral contraceptive for males also, sir?
Huh?
Are there oral contraceptives for males also, sir? Not only for females?
No. Why males? Females has to take. Okay. Yeah. A female has to take this oral contraceptives. Males barriers only enough. Barriers are enough for the males. Practically, you think, right? So this is all about oral contraceptives topic. Okay, next topic, injectables. Next topic is injectables. Can I erase this? Give thumbs up reaction if you have understood this. Still many students are not giving thumbs up reaction. That means they are not listening or what? Okay, next topic. Actually, it was a very good question. So what will happen if we take the extra dose? Definitely there may be a side effects. Okay, more than the recommended dose means anything which is crossing the limit, definitely it will be overdose only. Okay, next topic, injectables. The name itself there, no, injection, right? Injections, again females only. Only here the contraceptives you clearly observe, except barriers, remaining all females only we are studying. That means females are most important individuals here, right? Which plays major role, right? Pregnancy comes to females only, no? That's it. Okay, simple logic. Next, injectables. The drug combinations, whatever we have studied in oral contraceptives, same drug combinations, here used by females only, but in the form of injections or implants. So here, what are the drug combinations? What are the drug combinations here? Progestogen, I'm writing again. Progestogen or estrogen, drug combinations are used by the females, in the form of injections or implants. Injection means we know, right? Intradermal injections generally. Okay, intradermal injection. And implant means these are specialized matchstick-like structures. They look like a matchsticks. With a simple surgery, they will be kept under the skin. They are called implants. Okay, under the skin. They kept under the skin. Implants. They look like a matchsticks, like that. Matchsticks, implants. They'll be kept under the skin with simple surgery. The skin layer has to be opened, and these implants will be kept, okay, under the skin. They will not disturb the functioning of anything, because on the superficial layers of the skin, you are going to keep this in association with the blood vessels. Okay, they will be in association with the blood vessels and release the same drug combination. These implants are equipped with the same drug combinations, and they will slowly release into the blood. They'll be released into the blood. Of course, progestogen, estrogen, what are the effects we studied in oral contraceptives? Inhibit ovulation, inhibit implantation, and increases the cervical mucus to retard the entry of sperm, to prevent the entry of sperm. Same effects because same drug combinations. Same effect. The only thing is there in the form of oral route, the tablets are taken, but here injection, implants were taken. That's it. Okay, in the form of injection or implants will be taken. But the thing is, their effective period will be much longer. Effective period will be much longer will be much longer. The effective period will be much longer. Same drug combinations and same effects. Okay. Same effects as oral contraceptives. Same effects as oral contraceptives. Okay. Same combinations. Even progestogen or progestogen estrogen combinations and intrauterine devices. Okay, are used as emergency contraceptives. Within the 72 hours of the unprotected coitus. It will avoid the pregnancy. Generally, it will avoid the pregnancy. Okay, due to the unprotected coitus. Okay, these agents, especially oral contraceptives, injectables, implants. Oral contraceptives we studied in the previous topic. Injections, implants will all same effect only, because same drug combinations. Same effect will be there. Next, surgical methods. Now we are going to study surgical methods. Surgical methods. surgical methods. The surgical methods are also called as sterilization methods. Sterilization methods. Sterilization methods. Sterilization methods. This sterilization methods helps to block the gamete transport. Helps to block the gamete transport. It's very simple. Thereby prevents the contraception, that we know. Very effective, and but there is no surgery can be done again. Okay, we can't do anything again. Once the surgery done, that's it. It is irreversible process. Irreversible process because surgical methods, right? Cutting the vas deferens, cutting the fallopian tube will be involving here. Cutting and tying back. Suppose vas deferens is there. Suppose it's a normal vas deferens from the testis. Okay, right? Vas deferens. It will be cut in this way. It is cut and tied back. Tied back. Okay, vas deferens is cut and tied like this. So definitely the testis may produce sperms. It won't affect the activity of the testis. Okay, only physically we are just tying the tubes. Okay, so the semen can be released out. The seminal plasma can be released out, but there will be no sperms, right? Got it? Because seminal vesicles are present here and prostate gland will be present like this, right? And bulbourethral glands will be present. This seminal plasma can be released, but there will be no sperms, right? Why? Because the sperms are produced, but they cannot be transported. No? Sperms cannot be transported. Understood, everyone? Okay, so this method is called vasectomy. 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 And second method is tubectomy. Ectomy. Last 6 letters you observe. Ectomy. Cutting and tying. Okay. Suppose it's a continuous tube, one tube. Okay. Tied. Cut and tied like this. So there is no transport. Okay, same thing. Here also, fallopian tube is cut. A fallopian tube, so ovary, okay. Infundibulum, ampulla, isthmus, uterus, right? Here it is cut and tied back. Okay, here also it is cut like this and tied back. Okay, so generally irreversible. The sterilization procedures, both are sterilization procedures. Okay, males and females. A small part of vas deferens is removed. Actually, a small part of vas deferens is removed or tied up through the small incision. So that the small incision on the scrotum. On the scrotum, you will tie it. Okay, they are shown like this, but on the scrotum only it will tie. Next, coming to tubectomy. Then tubectomy. Tubectomy, the sterilization procedure in the females. In this, a small part of the fallopian tube is removed or tied up through the small incision in the abdomen. Here scrotum, here abdomen only. No? Right? So this is vasectomy and tubectomy. Generally, side effects, you may get a question, sir, is there any side effects? Definitely, wherever surgery done, there will be some pains. Okay, being located near the abdominal region, abdominal pain may common, and some sort of bleeding will happen. Okay, and it may, in the females, it may leads to some irregular menstrual bleeding can happens, and in some rare cases in some rare cases, cancers also can cause, like uterine cancer, okay, uterine cancer or fallopian tube cancer, anything can happen, breast cancers, because the carcinogens, they are exposed to the carcinogens here, right? If they are exposed to carcinogens, or if the tubectomy is done in unhygienic conditions, they may get infected. This is how it is. This is all about the contraceptive devices. We have completed all the contraceptive devices, and you will get one MCQ from the contraceptive devices. Tomorrow we'll study about the next topic, that is medical termination of pregnancy, where we will study about amniocentesis process also. Harshita, one second. Both of you will address, one second. Harshita.
Sir, I have a doubt. When tubectomy is done, the ovulation takes place, and how will the ovum reach the other end of the fallopian tube? Will it reach or not? What will happen to the ovum later on?
Here, the secondary oocyte may reaches here, but the sperms cannot reach, right?
Yeah, what will happen about the menstrual cycle?
Menstrual cycle will happen. See, there is no any
The ovum?
relation between the physical tube and menstrual cycle physiological process, right? Physiological process will happens. Physiological process will happens, but physically it is cut, right?
What happens to the ovum? Where will it stay?
The ovum will be here only. That's it. Collected by infundibulum and then reaches
The ovum, it reaches the fallopian tube.
ampulla. It will reach up to ampulla. Okay, that is not ovum again. Secondary oocyte.
Okay.
Okay, it will be remains alive up to 24 to 48 hours because there is a lifespan.
Okay.
And after lifespan, it will die. It will degenerate.
Okay.
Okay.
Sir, will there be any infections caused to the ovary, sir?
Once again.
If tubectomy is done, will there be infection caused to ovary, not to the fallopian tube?
Can.
Like inflammation and all.
Can.
Can.
Any more doubts? Anybody? Okay. So tomorrow we'll study about medical termination of pregnancy. We call it commonly abortion process. Tomorrow we'll study about it. And in that, the amniocentesis process will come. Okay. I will explain about it. No issues. Because in the first class, Charanya has asked, sir, what about amniocentesis process you didn't explain? Yes, wherever the related topic comes, there I will explain. Okay. If the first topic itself, population topic itself, if I explain amniocentesis is a scientific procedure, you won't understand. You may not understand. So that's why medical termination of pregnancy, it is a related topic. So tomorrow only I'm going to discuss that. Okay. I'm ending up the session. Thank you very much.